Hello, my name is Dr. Allen. I'm a GP at Burley Health Centre in Sheffield. This is just a quick video because there's been so much in the news, lots of changes, general practices involved, and there's potentially quite a lot of questions that people might have. So this video is just going to tell you a little bit about an update around what we know about Omicron, why boosters matter, who can have the boosters, how you get them, and how general practice might have to work differently to help to achieve the targets that the government set out. So the first thing to say is that our understanding is that Omicron is a serious concern, mostly because it is so much more transmissible, so it's going to spread more rapidly. And then the other issue is that it appears that the vaccines that we've had are not as effective if they've only had 1 or 2 doses, and that's why the booster dose seems to be very crucial, and that's why we're going all out now to try and get as many people boosters as quickly as possible. It's also really important with this variant that it seems that the evidence suggests that it's possible it transmits before you get the symptoms, and that's why it's so important to use face masks, good ventilation, social distancing, avoiding unnecessary meetings with people. Even if you've had the vaccines, that's going to be really important. So the change that was made was we were planning on getting the boosters done by the end of January, and then that has changed to now being the end of December. And that's a significant increase. It's record numbers of people being vaccinated every day. As of today, this is true from kind of Monday the 13th night time. Anyone over 30 is able to book their booster if it's been 2 months since your last vaccination, so that's 61 days. But it's got to be at least 3 months before you actually have the vaccine. So if it's been 2 months and you're over 30 since your last vaccine, you'll be able to book it, but it's got to be 3 months since your second vaccine. And on Wednesday this week, it will be over 18s will also be able to book your booster jab. The vaccines are going to be a mixture of Moderna and Pfizer vaccines. Now, we're aware that some people will have had different first vaccines and second vaccines to this, but it's safe, and actually we think that these 2 vaccines are going to offer better protection for boosters, and that's why we're doing that. So how do you actually book? So it's really important not to ring your GP about this, because it's not something that we can arrange for you over the phone and on reception, and it's really important that those phone lines are kept open for people who are unwell. So if you go online, if you search COVID vaccination booster NHS online, you'll be able to. There's a booking system online that you'll be able to book through. And you can also ring 119 if you don't have internet access. GPs are predominantly going to be targeting those highest risks, so people who've had still due to have their first vaccine, second vaccine. If that's you, please do come forward. People who are immunocompromised, housebound people, care homes. So we'll be prioritising the people who are highest priority, and we'll also be creating appointments for for what's called a national booking system, the one that you book online that I mentioned. We'll also be creating spots, but the way in is not to call the GP surgery, it's through the online system that I've discussed. So there's some kind of understandable concerns about how we're going to manage this. It was well known that general practice was already overstretched. The work that we're having to do is always increasing, and the number of people that we've got to do this with is always decreasing, and so it's going to be tough. It definitely will be tough, but I think that there's a definite commitment in general practice to try and do what we can to increase the boosters. We recognise that we do this job because we care about patients and we care about you and we care about the health of this country. And right now it seems the priority is to really help with the boosters. But we also need to balance that with the day-to-day work and looking after people who are unwell as well. And that's something that's going to be a real challenge. Yeah, so I thought it might be useful just to give a few kind of few ideas of ways that you can help us. So I think the important thing is, I would say, as things are, don't do anything differently to what you normally would do. So if you've got an appointment booked, expect that to be happening unless someone tells you otherwise. I think there's not going to be very many people, not many. I don't think very many appointments are going to be cancelled, but if they would be, your GP surgery will let you know. So please don't ring your surgery to ask if it's been cancelled. They will let you know if that happens, and I think that's quite unlikely. If you're unwell and if you've got any concerns about your health, you do just have to let us know, because it's really important that we're not missing people who are unwell. We need to, for example, not miss people who've got cancer, for example. Those things cannot wait, and we can't expect you to be second guessing whether your problem is urgent or not. That is going to have to be our job. What would really help is if you can give good information to the receptionist. They're trained for this. It really helps if we have good information that they can pass on to us. They've got the same rules of confidentiality as the rest of the staff. And they are very, very important part of the team. And they save lives on a daily basis by using the training that we've given them, by using the knowledge that they've accumulated, and so they are really key in the team, both for kind of getting information from you. They pass on to information to us, and that can help us to prioritize the work, helps us to find the right person for you to see at the right level of urgency. At times we might have to ask them to pass on messages on our behalf, which we know is not ideal. It would be much nicer to have that straight from the clinician, but at times that does really help us to be able to ask them to do that. So it's just kind of flexibility. Also, there are sometimes appointments in other parts of the city that we might ask you to go to what often is called a hub, or it might be that the pharmacy that we might ask you to go to. So just please be flexible, because I know that's not sometimes not people's first preference. We are going to be overstretched, and we're not going to be doing things perfectly. Clinicians and reception and we just ask you to be patient. And if you've show your appreciation to the staff that if they've helped you, because that really helps us. And if you feel frustrated, please try not to get angry, because that does really set us back when we're working at the pace we're working, and we care as much as we do. It can be difficult if we're having to deal with aggression and anger. That does really make our lives more difficult. We are here to help you. We recognise there's been a lot of changes. It's going to be even more stretched over the next month or so. We are open. We've never closed. If you need to be seen face to face, we'll still be bringing you in. We are committed to this booster campaign, and we're also committed to looking after the needs of all of you over the next few weeks. So I hope this has been helpful. I'm sure I've not covered everything. I hope we still all can have some kind of a holiday, and it's difficult timing again. Okay, all the best.